Okay, guys, I've got your D for you. Now, this one we're talking about hospice in nursing homes for folks. So, with that being said, let's get the presentation going that I have for you. And then if anybody has any questions, comments, concerns, I will address those after. Okay, here we go. Short answer. Hospice service hospice services in a nursing home are usually paid by Medicare Part A or other hospice payer. While the nursing home room and board are not covered by Medicare's hospice benefit and must be paid separately, typically by Medicaid, private long-term care insurance, Medicare Advantage, Medigap, or out-of-pocket. Payment overview. Hospice is a distinct benefit that covers medical and supportive services related to a terminal diagnosis, nursing, medical, equipment, medications for symptom control, social work, spiritual care, and is the most commonly paid through Medicare Part A for eligible beneficiaries. U.S. News Health, Medicare. Medicare's hospice benefit pays the hospice provider for those hospice services. Once a patient elects hospice and meets eligible criteria, Medicare, careers for Medicare and Medicaid services. Who pays for hospice services? Medicare Part B or Part A is the primary payer for hospice services for most eligible older adults. It typically covers hospice visits, medication related to the terminal illness, and hospice nursing, and counseling at no additional charge to the patient for those services. Medicare Centers for Medicare and Medicaid services. Private hospice organizations also accept Medicaid private insurance and some Medicare Advantage plans. And hospice will bill the appropriate payer based on the patient's coverage. Who pays for nursing home room and board? Medicare's hospice benefit does not pay for routine nursing home room and board. The daily cost of the bed, meals, and general custodial care. When a person receives hospice in a nursing home, those charges remain the responsibility of the resident or other other payer. U.S. U.S. News Health for people who qualify financially and medically. Medicaid often covers nursing home room and board. So a resident on Medicaid may have those costs paid by the state program. Seniorliving.org. If a resident is not Medicaid eligible, private long-term care insurance, Medicare Advantage plan, supplemental coverage, Medigap, or personal funds are common ways to cover room and board. U.S. News Health, Vitas Healthcare, practical steps and considerations, confirm hospice eligibility and election. The hospice and the attending physician must certify terminal prognosis, and the patient must sign the hospice election form for Medicare hospice coverage to begin. Centers for Medicare and Medicaid Services. Ask the nursing home and hospice about billing split. Clarify which services the hospice will provide and bill for, and which charges the nursing home will continue to assess. U.S. News Health. Explore Medicaid and insurance options early. If room and board are a concern, check Medicaid eligibility rules in your state and review any private long-term care policy terms or Medicare Advantage plan benefits that may help cover facility costs. Bottom line, hospice services themselves are usually covered by Medicare or another hospice payer. But the nursing homes, room and board are separate costs that must be covered by Medicaid, private insurance, Medicare Advantage, or Medigap out of pocket. So coordinate with both the hospice and the nursing home to understand who pays for what and to plan finances accordingly. Okay, guys. That's your D for tonight. For now, Gator Wellness. Take care, folks. Have a good evening.